So don't I. I'll call this meeting to order. Eric, have you had time to look through the minutes from May 4th?
Yes, and I had two minor adjustments.
Okay.
The first one is after the where it says emergency team meeting. This is the second page halfway down. It should say Zoom calls as opposed to Zoom calls.
Okay.
And the other thing is that 3/4 of the way down where it says with stay at home, it probably should say all pediatricians in Greater Lowell. There's a practice that's named Greater Lowell Pediatrics.
Yeah, there is.
So I say pediatricians in Greater Lowell want to ensure all children are receiving their normal routine vaccinations.
Where is that one, Eric?
Under
third paragraph from the bottom.
Hospitals. The next one says with stay at home.
Yep.
And we should say all pediatricians in Greater Lowell.
Oh, yep.
I got it.
Okay.
And the last thing is on the very end of it, Eric Meikle is with a C.
Oh, sorry about that.
No problem. I didn't get married this time, so that was good.
Looks good.
So motion to accept. With those
Second. Any further discussion? All in favor? Aye. So it looks like the mosquito spraying is going to go on, notwithstanding the COVID-19.
Correct.
COVID.
It's all done outdoor.
Yes. Okay. And
so everybody applies online, and then they go out and assess.
Okay. So why don't we, since this is going to be put on the television afterwards, why don't we tell them the number to call?
Oh, okay.
Okay. Or the email address. And this is if they want their yards done, correct?
Yes.
Okay.
So let me find.
I saw it here earlier today, so I know it's in there.
The website is www.cmmcp.org. It's there under the heading seasonal updates. And the town website, which has the link, is www.townofchelmsford.us.
Okay.
Yeah.
So anyone that would like to get their yard sprayed for mosquitoes can call and get put onto their schedule.
Right, and they have to pre-register online. The office number, for those who want to know, is 508-393-3055, and they're open Monday through Friday, 7 to 3:30. And this will be posted on our website as well. We just received the dates up through July 2nd that they will be in Chelmsford. And it's June 2nd, 8th, 11th, 17th, 23rd, 29th, and then July 2nd. And then they'll send us another update for the dates in July, which we will put on our website once we get those.
So if you want to be done in June, you need to get registered.
Yes.
Okay. All right. So this has to do with, the next thing here has to do with the presentation that we got last week or last month relative to the vulnerability preparedness. Is that correct? Is that what we were presented last week? No. Okay.
No.
So
last time was about the biotech. That was the presentation.
Right.
And,
so we still have that on hold.
all right. So what is this, Sue?
This is basically a letter of support that I wrote and gave to our engineering department, because with the stormwater project here in Chelmsford, they are doing a lot of their stormwater work through grant funding. And what they asked for is a letter of support from the health department to renovate the Dunshire Road culverts. Which we've received numerous complaints over the years. Those culverts get backed up and they flood people's yards, and the application will help the Stormwater Master Planning Committee do a whole renovation of those culverts. So this was just a simple letter to them saying that the health department supports this application for the grant.
Okay, thank you. And then we have a renewal of the restaurant, the meals up for the establishment, their licensing.
Yeah, so it's actually, and I noticed this afterwards, we're gonna have to change that. The beginning of that says dear establishment.
Yeah, that's what I thought. Who are we talking about here?
It's actually, that went out to all the restaurants. We're gonna have to change that to dear restaurant owner or manager or something.
Right.
But it did go out to all of the restaurant establishments in
Okay,
town.
so because I question that, do you think that you need to remail these?
No, we've had a very steady flow of applications coming through from all of our restaurants, renewing their applications, paying their fees. I checked with Donna this morning, and correct me if I'm wrong, Donna, but I think we had only about 35 that we hadn't heard from yet, out of almost 200 facilities in town. So, but it's funny, I just saw that as you.
Right, I'm saying, what is, I thought it was the establishment. Okay, right. As long as the business is not confused.
Yeah, so Christina upstairs was actually, all of her emails that have been going out about COVID to any of these facilities has all been listed as dear establishment.
Okay, so we may have to talk to her as well. We may have to just mention to her our discussion about it.
Right, so we use the same wording because that's what she's been sending out a lot lately, so.
So we're not going to use that word anymore.
Correct.
Okay. All right, just to be sure.
So, yeah. To double check the dates on this, it says that it went out on April 8th and it was due on May 1st.
Yes, because all of the permits expired May 31st. So
165 institutions that are no longer in compliance, that they have failed to meet our requirements.
No. So this went out to what, Donna, about 200 in total?
A little over that, yes.
Yeah. And of all of those 200, all except for about 35 have returned their applications, their payment, all of their certifications required. We have a few that are outstanding, maybe some of the paperwork that they didn't fill in, and we Donna outreaches to them, just, you know, we received your application, we received your check, but we need this document to get them registered. So 35, I think, in the time of a pandemic, with most of them, all of them not being closed, but being closed to, in indoor seating, I think is pretty good.
And there is many of them, because this also includes adult daycare. This includes child care. This isn't just restaurants. It's all of the permitting for, it's liquor stores, it's variety stores, it's all of the ones that are, it's about 80% of our permitting happens for May.
Okay.
So if they don't renew and this quarantine gets lifted, then they're gonna have to come in. Is that correct?
Yeah. So if they don't renew, then they can't really function without a permit.
Right.
So, and because of, COVID, and because, these, as we had talked about, and actually I've been on so many Zoom meetings that I can't remember if I talked to you guys about this or if it was with the emergency team meeting that we had talked about, that initially we would give people a little extra time to get this in without charging them late fees. Because typically if they don't submit their stuff, they pay double fees.
Right.
But under the circumstances, because a lot of these places, particularly restaurants and daycares and all that, they've been hit hard. So if they need a little bit of extra time, and Dawn has been doing a great job outreaching to them and answering their questions and really following through to get this done, because this is a huge job.
Yeah.
Do we do anything formally to allow for leniency? If a place is closed, they're obviously not, if they don't have a permit, they're not going to serve food. Right. But if they close for 5 months and then they're trying to scrape things together for July 1st, if they bring the papers together for the middle of June, is that something we just can, is there anything that Anne Marie and I need to vote on here, or?
No, we would just have Mark and Michelle would completely review all of their paperwork as soon as we could. in order to let them open. You know, we'll do whatever we can so that they can open in a timely fashion.
Okay.
But you're not going to be assessing them the late fee presently?
Correct.
Okay. All right, motion to accept the incoming or the correspondence?
Okay.
Seconded.
Any further discussion? All in favor? Aye.
Anne Marie, that was outgoing.
Yeah.
Oh. Okay.
Going correspondence.
Let's put outgoing in front of correspondence.
You got it.
Now we'll go on to the correspondence dash incoming. We got the mosquito control here again.
Do we need to ratify helicopters?
So this was, they just send this notice to us. They send this notice to the Chelmsford Police when they're going to have the helicopter in town doing the larviciding. And they always notify, you know, CC the Board of Health on it as well. And then those are the dates that they're going to be in Chelmsford, which we announced earlier.
So is this 11 Oak Street in Chelmsford, this letter from FSL, is this telling us, have they connected like we told them they had to?
Yes.
Okay.
Well, actually, no, 7 connected.
This letter is actually because they had a spill that we had discussed at a few months ago at one of the meetings, and this is the ratification to this.
That they remediated. So where are we on the septic?
Oh, so to finish up with the spill. So the spill was over at the mobile home park, and it just so happens that the company that cleaned it up was based at 11 Oak Street. Is that why Oak Street's on?
No. So 11 Oak Street was the one several meetings ago, if you remember, that we that they sold, you know, and they were coming to us about the whole septic.
Yeah.
And so after they actually purchased the property, it was determined that there was some type of a release at that property, and DEP sent them a letter as the current owners, basically saying that they had to do a remediation of that problem. So this is the letter saying that in accordance with the Mass Contingency Plan, this document is addressing that spill. And they're saying exactly what they're going to do to address that spill. The second letter was another spill at, in the trailer park on Morocco Avenue.
And what spilled over on 11 Oak Street?
I don't know. They send us, so we get notification from DEP every single time they find any kind of a hazardous spill that needs some type of remediation.
Okay.
And they send us a copy of the letter that says the person has to remediate the problem as the owner. And then typically the owner hires a company to do that. And then that company files their plan with DEP, and we also get a copy of that.
Okay. So we don't know what it was, but DEP is satisfied that it was identified and then cleaned up.
Yes.
And then the kerosene spill over at the mobile home park, they gave us much more information on this one.
Right. Well, this was actually from Clean Harbors. They gave us a lot more information. But if you notice down towards the bottom, it says that it basically, this concludes that a condition of no significant risks exists at this time after they cleaned it up.
Okay.
Okay, and then we have another one here?
There's a lot of them in here.
Oh my goodness.
And of course, don't forget, this is 3 months worth.
Right.
This is March, April, May.
So what's at 83 Turnpike?
84.
84 Turnpike, yeah.
So this one was groundwater cleanup from a spill that they said was, concentrations of this trichloroethene in excess of what was reportable. And that happened in September of 2016.
Wow.
And then part of this follow-up confirmed that the unknown source had occurred at the southern portion of the site. So this document goes into how they also looked at addresses further down from there, like 81 and 83.
Mhm.
And so they were remediating that as well.
Is 84 residential?
84 is a business. 81 and 83, I believe, are residential.
Okay. I think we saw something of this before.
Yes, we saw the initial notice from DEP that they had to remediate it.
Yeah. Okay.
And then we have a problem at UPS.
Oh, wait. Before we get there, with regard to 7 Oak Street,
Yep, so they're all tied in.
what's 1 Oak Street Trust?
So that's the discrepancy between, it's listed in some places as 7 and it's listed in some places as number 1. And we were never able, it's the same property.
Okay.
But that was tied in, so they're all set, so they complied.
And 11 has not tied in yet.
I believe they have. I think they tied in before. Donna, didn't we get notification from them that they tied in earlier?
I believe they had tied in very early in April, but I can reconfirm tomorrow.
Yeah, I'm pretty sure they're all set.
The last I recall was there was some discussion with their attorney about having access to put it in. Do you recall that? We referred it to town council. They didn't think they had the right to go over private property.
You know what? I do remember that now that you say that, Anne Marie. So we'll have to look into that. But why would 1 or 7 be able to tie in? It's on the same street. So I guess we'll have to.
I don't know.
Yeah.
Well, I mean, isn't 1 or 7 at the end, and 11's in?
Yeah.
Closer to Littleton Road, you mean? Right.
Right.
Yeah.
So I mean, 7 might have been able to access it through their own land.
Mm-hmm. Okay,
But
we'll look into that one.
And I thought that, aren't the 2 properties side by side?
Yes.
Yep.
Because I thought that the discussion was that they'd have to go through somebody else's, but they could try to coordinate with 1/7 and do 11 at the same time.
Dr. Miguel, I think you're correct. I think the confusion with 11 was they were being told they had to tie in first, and 7 was at the beginning of the street. So they both did have conversations and I believe had coordinated together.
Okay.
That was to share costs, right, Donna?
Yeah, and more to get, like 11 needed permission to kind of start with 7, and 7 needed to tie in first on the main road.
We'll look into that.
Same company.
Yeah, I just would like to know that 11 has done what we asked them to do.
I will confirm, yes.
Okay.
So Brick Hill Road. This is UPS, so this is nowhere near the wetlands, which I think is on the other side. Is that right, Sue?
Right, further.
Further down on the right.
Yeah.
Okay. So what happened there?
So again, it was a hazardous material that got released, and it was reported, DEP is basically saying to them that because they own the property, that it's up to UPS to come up with a remediation plan. And it's basically giving them in this whole thing what the liability is because they own the land and what DEP requires of them to do as far as an immediate response action. So now that they've received this information from DEP, this was just mailed to them on May 20th. So this was, this spill happened on April 9th. So it just happened in the last couple months. So they'll have a certain period of time to issue a remediation plan to DEP. and they'll have to hire a company to do it. And then once that happens, we'll end up getting a copy of that from the remediation company.
Was this a new or a historic spill?
This appears to be new.
Okay.
Yeah, they have 120 days to respond.
Yeah.
Okay.
So.
Then we've got 18 to 20 Boston Road.
So this goes back to a while ago when this is behind the plaza that has Adiamo's Dunkin' Donuts.
Oh, yeah.
So we had received a complaint last year after, I want to say it was right after the winter, about a sheen being on that pond back there. And we had gone out, we met with the owners, DEP came out at that point because they weren't sure what it was. And they barricaded it off and they were doing some testing and they've been monitoring it ever since. And recently they discovered that this actually must have had an underground tank somewhere. So now the owners of that plaza now have to again remediate this as
Yeah,
well.
they've had problems there before.
Yeah.
All right.
And they've had all kinds of, pads and booms and all that to try to mitigate. I guess years and years, maybe it was a disposal site years ago, I think, is what they think.
Really? It's been a plaza as long as I can remember.
Right. It says,
I think it was when I was in high school.
yeah.
Okay.
Do we need to do anything with the emergency response plan for the Chelmsford Forum?
No, that was just in response to a follow-up that when we had the complaint about the buses being stored there and
Right.
the concerns about the buses being so close to conservation land or whatever, I had reached out to the water department and all that because there was concern that it was so close to the wells. And I had a conversation with Todd Melanson and he got a hold of them, and this is their, he realized that they needed to update their plan. So this is their most recent emergency response plan with the buses being there, should they have any leaks or spills or whatever, and he had them update the precautions there.
Okay.
That was just a copy of that.
And what's going on at Katrina Road? Isn't that residential?
Katrina Road, no, when you go all the way down to the end, it's commercial.
Oh.
Actually, Katrina Road is, I believe, don't quote me, I don't know if the town bought it or is renting it, but they're doing renovations over there and upgrading the site because that's where the buses are going to end up being moved to. For Chelmsford buses.
Okay.
So, and it's an old site that did have known hazardous waste. So they're just, this new path again is doing their release measures and submitting them to DEP.
Okay. And when we review the asbestos abatement descriptions, we're just, because it's asbestos, there's nothing we're supposed to do on those, correct?
No, it's just a requirement that the company report to the Board of Health when they're doing asbestos removal. And they submit where they're going to be dumping it, the date that they're going to be doing it, and that type of thing. So it's just a formality that they inform us and give us copies of these forms.
I think the Pam Railroads is self-explanatory.
Yep.
And we have a rabies, huh? A cat?
Yeah, negative though.
Negative.
Feral cat, I assume?
They don't put it on the report, so you never really know.
Well, they said the location of the cat's unknown, so.
Yeah.
Yeah, and they don't have a name. Okay, motion to accept incoming correspondence.
Second, any further discussion? All in favor?
Aye.
Aye.
So this is the letter we sent to the Conservation Committee.
Yes,
With-
after our last meeting.
Mr. Wojcik's concerns about the aggregate industries.
Right. And of course, right after this letter is when we kind of went into lockdown from COVID. So I don't even know if they've had a meeting to even look at this letter. I haven't heard any response, but it doesn't necessarily mean that they even saw it because I don't know if they've had a meeting.
Okay. All right, when you're done, Eric, we can talk about the COVID-19 update from Sue.
Okay. Motion to accept old business if we need to accept.
Seconded, any further discussion? Well, excuse me, no, we need to do the COVID-19 first.
Okay, fine.
So basically, in Chelmsford, as of today, we have 317 confirmed cases of COVID, which is, I would say about a week or so ago, we had 310. So the fact that we've only had about, 7 or so in a week is pretty good. And we have 55 active cases, which is really good news because we were well up into the, close to the 200s for active cases. So essentially active cases are those right now that are currently still in either isolation or quarantine due to their being confirmed positive. And we have twice weekly calls with the Department of Public Health, and they provide updates to us on, COVID, what's going on, what their plans are, what the intentions are. Unfortunately, what happens sometimes is that, things get announced by the governor on TV before they notify the local Board of Health. And that has been raised several times to the people at the Department of Public Health, by local boards of health, basically saying, can you please notify us first of what you're going to be telling the public, because we're getting phone calls and we haven't even received the information. So they are doing their best to notify us ahead of time before they do put it out to the media. It's no secret that this is a fluid situation. It is continuing to change daily, weekly. We're getting constant updates. Sometimes we get information from DPH, and then local boards of health on the phone call will question the logistics behind what they just said or the comment they just made, and they'll go back and they'll clarify it. And then they'll come back and they'll tell us what they think. So we don't always get the answers right away. If the question comes up on a Tuesday and they don't know the answer, we may not get the answer till Friday, but they do try to get it to us as quickly as they can. So today, for example, they did have an additional phone call, which we normally don't get on Mondays, just to inform us that they are going to be coming out with guidance on summer camps and the opening of summer camps, because clearly that's a huge issue for a lot of families who use summer camps for their children, and there was also some guidance, I believe, that's going to be coming out about daycares as well, and the different phases. They're not really telling us specifics about the different phases. The only thing that we've been told is that we believe that phase 2 is going to be somewhere between June 8th and June 15th. And obviously those dates are going to be based on what the numbers are and what the trends are. And hopefully, as things are loosening up, we don't see a huge increase in cases across the state, because if that happens, then these different phases will be extended or they'll go back to the previous phase. The other thing that they're talking about, that they're moving forward on doing with restaurants, is going to be allowing outdoor seating with very specific requirements as far as spacing of the tables, number of people at the tables, the sanitizing, the numbers of people that you can have at one time, the hand washing, the face coverings. So all of that guidance is coming forward. So we as a town, the Board of Health, our department, has been working very closely with the building commissioner, as well as police and fire, and and also the planning department, so that we want to streamline applications for these restaurants. Some of them who don't already have outdoor seating, who may want to incorporate outdoor seating. We've had these meetings so that we can incorporate and create one application for them to do this, to make it easier, and then each department will have a sign off. Each department has put together what would be required based on the department regulations. And it was also decided there would be no fee, no application fee under the circumstances of the pandemic, so that we could work as best we could together as a group to get these people open for outdoor seating. So I think we're going to see that in the next couple of weeks for whichever restaurants and food service places that are going to be able to do it, because it's also going to be a financial impact on them. You know, we're doing the best that we can with enforcement. It's been perfectly clear, and I think everybody knows that as they change the guidelines, as they loosen up regulations, all the enforcement falls on the local Board of Health. And so our ultimate goal is the health of the public for the entire town of Chelmsford. And that has to be our overarching goal in everything that we do. And ultimately, we're trying to educate, and we're trying to explain why people should wear masks, why people should stay 6 feet apart, why people should wash their hands. And that's our ultimate goal, is to educate and to protect the health of people in Chelmsford.
So Sue, I've had conflicting opinions on the wearing of gloves.
So the wearing of gloves is not actually a recommendation. I know a lot of people wear gloves and they think, okay, I go into a grocery store and I wear my gloves because I'm touching things, and you know, and then they take the gloves off and they throw them in the trash. But unless they take the gloves off in a proper way, they're really better off washing their hands. Mm-hmm. That is the absolute best way to prevent this virus, is to not touch your face, wash your hands, keep your distance from people. And that's, you know, repeated over and over again as far as the best transmission. They don't really know how long this virus lasts on objects. You know, it's run the gamut from, oh, it doesn't last very long, to, oh, we think it lasts several days. And so the jury is still out on that, at least based on the latest information that I have. And so, again, we really encourage people to do the hand washing versus the gloves. And, you know, and if you can't wash your hands, use hand sanitizer that has at least 60% alcohol in it.
So, assuming that there's people out there that feel more comfortable having gloves on, my understanding is that there is a particular way to take the gloves off.
Right. So the particular way to do it is that you don't actually, it's kind of hard to demonstrate without actually having gloves on. But if you have gloves on, you assume that both gloves are contaminated. So if you take one hand and you touch the outside of the other glove and you kind of curl it underneath the wrist area to peel it off, and then you want to only touch the outside of the other glove to peel it off, so they kind of fold into each other,
right?
And then you can throw them away. So
just don't touch your skin taking the glove off.
Right.
Okay. Right. All right. I mean, some people do wear them, some people are not wearing them.
Eric, do you have a better way to describe that?
I was going to say that, you know, what you do is it looks kind of like a figure eight. You basically take your middle fingers and you grab the wrists of each, so you take them off at the same time. They just sort of peel off one into the other. But I think that a lot of the information that's coming out the last week is showing that it's really the aerosolization. It's really what people kind of spew into the air that is the primary way that this is transmitted. But they've gone back and looked at what comes from the surfaces, and it doesn't look like that's not how people are catching it. When it first came out, they actually had a New England Journal of Medicine study that showed how long it lives on different surfaces. If you asked me to summarize it, I'd say that if it's cardboard and paper, it lasts about 2 to 3 hours. And if it's on plastic and metal, it was something in the 24 to 48 hour range. And the problem is that they had like 10 different surfaces they looked at. And to summarize it, the more porous it is, the shorter the virus lived there. But it's the aerosolization. So that if you're going to wear gloves and you touch 2 people, you're not protecting either of them. You protect yourself if you take it off properly. I was going to say the biggest thing about taking them off is to make sure you wash your hands afterwards. And one thing going back to the aerosolization is that there's a problem now, because what a lot of people did is they went out and they bought the fancy masks that you can wash that have the valve in it. What the valve allows you to do is when you breathe in, you'll breathe through the fibers and it'll filter what you're getting. But then when you breathe out, it just releases. The valve opens up and it goes straight out, which means that those fancy masks that have a valve they don't meet the requirements that the state has put forward. You should have one that has no valve so that it's filtering the air that comes in and the air that's going out.
Yeah. Okay. Good to know. All right. Anything else, Sue, you want to add on the COVID-19 before we move on to the new business, which is going to continue the discussion?
I don't think so, other than, people can go to the mass.gov website and get a lot of their updates. We're posting as many updates as we can to the Town of Chelmsford website as well. And we're trying to keep up because it's just constantly changing.
Yeah.
I think that I had talked to Sue a while back about concern that some of the pediatricians, there's an awful lot, like 80% of the pediatricians in the area have their offices in Chelmsford. And the fear is that when the daycares open up, what they traditionally do is any child that there's any question, they say, well, you need to have a letter from your pediatrician certifying that you are not contagious. And there's no way that we're going to be able to have that we don't want that number of sick people unnecessarily coming in to get a piece of paper, that B, we can't certify, because somebody who tests, even if they test negative, it doesn't mean it's not incubating in them. And so the state to come up with some better solution for how to clear patients or students for returning to daycares. But their initial response, I think, they said they're going to look at doing this for, it sounded like school in September, but whenever they open up the daycares, that's when we're really going to need it.
Okay. All right, I will make a motion to accept the old business. Do I have a second?
Second.
Any further discussion? All in favor?
Aye.
Going on to new business. So Sue, you've been in contact with Westford about Newport Material Industries. They're going to be opening up soon, or they have opened?
They're not open yet. Westford Health Department reached out to me a few months back because they were doing one of their inspections prior to their opening. And because it was in such close proximity to Chelmsford, the director over there reached out and asked me if I wanted to attend a meeting that they were having, kind of just a walkthrough for the plant owner manager to explain kind of the function of the plant. So that's what I did. I attended, and they basically were explaining, how things were going to work, where trucks were going to come in, their different pieces of machinery that they had that were going to control, noise and odor, etc. The director also told me that, and we discussed it on this particular visit, I was just a guest, but I know that they talked about, and part of the discussion was, would the plant actually kind of give information to, say, Chelmsford employees or whatever, if they were interested after the plant opened up. And they said that they definitely would. So I was actually in touch with the director there today. And although they had hoped to be open by the end of April, they still had a couple things that had been delayed because of the pandemic. So their ultimate goal now is to be open by the end of June. So that's what they're aiming for. But as of right now, they are not open or functioning for business.
All right. Any questions on that, Eric?
Nope.
No. So Sue, let's talk about the beaches, which we have unfortunately had to close, and give us a little background on what happened here.
So, the beaches were open, and we had the discussion as a group as to, should we allow the beaches to stay open? And our original decision was that why close them unless we give people an opportunity to use the beach and go by the guidance. So what we did is we had signs made and we posted, there were 4 signs posted at each of the beaches listing Governor Baker's and DPH guidance for the opening of the beaches, as far as the social distancing, the wearing of the masks, and the precautions that people needed to use when they were on the beaches. And we were doing that, and not even a week after those signs were posted, I received phone calls with people complaining about the beaches and too many people on the beaches, nobody's abiding by the rules, nobody's doing social distancing. And, we can't just have somebody sit at the beaches and monitor the beaches all day, because we're trying to do other compliance issues and the other jobs that we have as a health department. So I understand that people want to use the beaches and they want to go swimming, but as we said earlier in this meeting, we have to be concerned with the public health of everybody in our community. We have about 34,000 people that live in the town of Chelmsford. And if people are not abiding by the social distancing rules, and they're not going by the guidance from the governor, which again, we have been charged with enforcing, then potentially somebody ends up coming down with COVID, and then they go home and they spread it to a grandparent or they spread it to somebody else. So people have to understand, we didn't just close the beaches just because. We gave people an opportunity to go by the guidance, and people didn't go by the guidance. And that's when we decided that we had to close them because of the public health risk to more than just those individuals on the beach.
Right, and as you know, I did last Wednesday take a ride by Hot Pond, and there was minimal compliance with the rules, despite those signs. There was groups of teenage girls all together, no masks, not 6 feet apart. They weren't even social distancing in the water. And I had, when I was leaving, there was a young mother entering with probably a 3-year-old, I would say, and neither of them were masked. So I think that there's some education that has to continue before we can open these beaches up.
Yeah.
I think it starts, the Chelmsford Independent, to their credit, they actually published last Friday an entire article listing what has to be done when you're at the beaches. And I know that our closing of the beaches has been, reported by the Boston stations and the Boston Globe. And this is all welcome because they're educating the public. So when we do decide to reopen the beaches, I think we can expect that people are A, going to have a better understanding of what's expected of them, and B, understand that we cannot allow them to behave as business as usual at the beaches. Like you said, I mean, there were maybe 50 people at Hart Pond. We can't put 34,000 people at risk for 50 people that want to go to the beach.
Right.
And I've brought this up to you before. I think the parking lot there is horrendous. There's no opportunity there to social distance. And I do understand the argument is, you know, they're not behind their cars more than 15 minutes and then they're riding their bikes. I mean, I hope you're right, but that troubles me as well as the beach.
Mm-hmm. Well, we've received complaints from some people saying, you know, when are you going to close the bike path? But again, you know, if we go by the DPH definition of close contact and go by their guidance, you know, it is now mandatory that when people are in public that they wear masks. So at this point, unless you have a health condition, if you're on that bike path, you're supposed to be wearing a mask because you're in public. But with that being said, the people that are on the bike path, for the most part, you don't see people congregating on the bike path, having conversations, whatever they're moving, whether they're walking, jogging, biking, they're moving. So they're not necessarily, you know, within 6 feet of another person for 15 minutes or more. So that's the reason behind, you know, we're not going to close the bike path. And people do need to be outdoors. People do need to get fresh air. You know, it's that time of year. And that is just as much of an important health issue as, you know, protecting us from the pandemic. And so the parking lot at Hart Pond, although it's, you know, it's small, if people are loading and unloading their bikes, and obviously if it's a couple of people that are in the same family, then obviously they live together, so that's okay. But typically it doesn't take more than that 15 minutes for people to take their bike off.
When they come back from their ride, their run, whatever it is they're doing, they need to get in their car and leave. Mm-hmm. They can't, you know, congregate on the back, you know, the back of the car.
Right.
You know, this is like the rule of a lot of golf clubs. You can't get there in more than 15 minutes before your tee time, and you have to be gone by 15 minutes.
Right.
So, I mean, I think they've all just got to think a little more about this situation. The other thing that's a little concerning down at Hart Pond is the number of, I'd say, middle-aged kids that are riding their bikes and hanging out there and hanging out at the mobile station. And the
middle-aged kids?
Middle school kids.
Okay.
They look to be that age to me, all right? They're not masked at all. They're not social distancing, and they're not masked. And I don't know how you can get to the kids at that age unless you can get to their parents and have them remind them about this. Now, some of these kids actually have the mask, and 1 or 2 of them wear the mask. The others that have the mask, it's generally hanging down around their neck. So they have the mask. They left home with the mask, okay, but they're not wearing the mask. But what's a little concerning to me about this is that we have someone that helps us out at the beach pro bono. And he cleans the beach up in the morning, and he cleans the beach up at the night for us, which is really nice. And we did receive an email for him, and I just want to read a little bit of what his email had to say. And this is also from last Tuesday. And he said he was at Hart Pond, and that less than 5 people had masks on, and I can confirm that. Large groups of teens, which he says is 10 years over, not wearing masks, and actually gave him a hard time because he was wearing a mask. He explained to them that they need to follow the rules and was told it's a free country, the Board of Health has no power, and we don't care. Well, you know, this does not help us when this is the attitude these children have. And so what he has said is that he cannot continue to help us clean the beach or clean the beach on his regular schedule because being around this many people without masks, he's an elderly person, it's not good for his health. So what I'd like to do is just kind of get out to the parents that they have to help us here. I mean, they've got to help us get their kids in this middle school age to understand that it's not about them, it's about all of us. And they really should be wearing their masks. And they congregate at the mobile station. And I mean, the mobile station's got some tables that are out there, but they're not social distancing. They're all sitting at these tables together.
Right.
Now, I think part of this, and Dr. Miko, you can help me with this. I think part of this is this belief that young people don't get this, that children are immune or something.
So I think that that probably applies more to college kids. I think the problem is that teenagers always think they're immune from almost anything. If there's a 1% chance it'll succeed or they won't die from it, they think they're going to be that 1%. And we've been bumping into problems. If I remember correctly, that with the tennis courts, there was reports that teenagers were collecting on the tennis courts. We got notification the high school is saying that they're having to invest money to clean up the parking lot because the teenagers have started to accumulate over there, and they're at the ponds and such. And the term, the phrase that it's a free country. I mean, we have rights, but only insofar as they don't impinge on somebody else's rights. And once you put somebody else at risk, then you don't have the right to fire guns into houses and such. And in this case, you don't have the right to congregate in a way that could put other people at risk with regard to the disease. So I'm just wondering if, I'm not sure, because I think a lot of these kids are trying to figure out how to get out of the house and collect, and not necessarily with the parents. Parents would be one technique, but the other one would just be to say that, have a mask, and if you don't, is there a consequence that they actually care about? But we don't want to go around policing, and the police don't want to spend their day looking for masks and such. So I'm going to have to put my head around this one a little bit more. But it's by human nature, they're going to want to escape from the house. They're going to want to congregate, and they're not going to want to wear masks. And it's going to be a problematic population, whether or not they think that they really think at all about the disease.
Right. Well, it is something that I've observed, and I'm sure it's going on at other parts. And I would ask parents to try to educate their children.
I will say that if I've gone on walks over in Westford or other places, every time you go outside, that's where the kids are going nowadays. They can't go to the mall or anything. They can't go to houses. And every time you go out, you see groups of 6 to 10 walking along, trying to do what they can and trying to be somewhat responsible, but that creates a risk in and of itself, the size of the groups.
Right.
Well, I think that's what this gentleman was pointing out, that the size of these groups makes it difficult with his age to be that close.
Yeah.
So it would be.
I also, Anne Marie, just I did end up, one of our inspectors did go out and speak to the owner of the mobile station in regard to the placement of the picnic tables and all of that. And, we basically asked him to help us as far as, with the groups, and that if he put markers on the picnic tables, instead of all of the kids sitting at one picnic table, he could have the kids on either end of the picnic table, and he could spread them out so they could at least still congregate, still have their conversations, buy their drink in the store, socialize, and still maintain that social distance. And he had indicated that he would do his best to help us out with that, because again, we can't be there all the time.
Right, and I believe he's a reasonable, responsible businessman, and he'll do that. And I'm in no way saying that these kids shouldn't be out.
Right.
But I do think they need to be masked. And you can buy these masks now online that I am sure you could get one or two that the child would love to wear. I mean, they're skeletons and all sorts of stuff out there. but I just worry about the people who are pumping gas and going in and out of that store with unmasked. I don't care whether these children are the workmen at noon that aren't masked. So it's a little concerning, and it is a little concerning that it's creating more problems for us at the beach. When we start to go to open it, we have to be now worried about, policing it. And we don't have the staff to police these children. We don't have the staff to police these beaches.
Right.
And, the kids are wrong that we don't have power. We do have the power.
Unfortunately, it's a big stick to close that beach if that's the one thing we can do.
Yeah. Well, having done that, I don't think any of us want that to be the norm for the summer.
No.
But there's got to be some improvement in the behavior. And again, I believe this publicity we're getting is going to be helpful to us.
Right. And as the governor comes out with more guidance as we go into, phase 2, phase 3, they'll provide us with whatever loosening up of the regulations with each phase.
Yeah, it's true.
And so ultimately, the goal would be to hopefully be able to open the beach and again have people abide by whatever those guidances are at the time. And we're not the only, we did close the beach off after people were using it, but my understanding is that any public swimming areas that there are in Lowell and Billerica, they have not been open at all. So other communities have kept their beach areas closed. We're not the only one.
No, and that, as you stated, that was an option that was available to us, and we chose instead to try to educate the public and give them the opportunity to adhere. And, your signs are very visible. So it's inexplicable.
Right.
So we'll see now that they understand it, what they have.
My fear about getting teens to wear masks is it took us 20 years to get them to wear bicycle helmets. So we had to start at a very young age to get them into that. This is all of a sudden an acute onset, and to have them change behaviors. I'm wondering if you see a lot of parks are drawing circles and saying you could have a family group within, this each circle can hold a family group of up to 10 people. Mind you, I don't know, they're going to probably overly interpret that as my family is all my friends who live in different households. But I don't think we want to invest in too much, but like putting like ropes, circles of rope on like things and saying, you can go over there, you can go over there. When somebody leaves, somebody else can come, and putting limits on it that way. But then somebody has to kind of, again, police to go out there and say, hey, you got too many people here. You can't be in between. So I'm just trying to think of any way to sort of physically put something in that makes sense, or at least is easier to police than just leaving people to their own devices.
Well, I've seen that where they put painted circles on the grass. I don't know how that would work on sand, though. I don't see the permanency there.
That's why I said like the ropes. I mean, the only thing is that they're going to potentially move over the course of the day, but
yeah,
sand moves.
Right. Now, I personally believe education is what we have to do here.
Right.
And, I do think we did the right decision. I'm not changing the decision that Sue made about opening them and advising and educating the public. It was the right decision. And we will have to see how it goes, and hopefully we'll be able to open the beaches once again. But if we open the beaches again after the governor loosens up some of the requirements, and the same thing happens, they're going to close once more. I mean, this could be a vicious cycle.
Right. And the difficulty too is that we can't really rely on, typically in a non-pandemic year, the beaches would open with lifeguards on duty right after school gets out. And I think the official last day of school this year is June 16th. And The issue is, I don't even believe we usually contract through the Y to get our lifeguards. So I'm not 100% sure what the status is on that yet, but I know that there's concern about subjecting these young teenagers to any kind of enforcement. You know, you can't, I don't think that it's fair to subject them to enforce the guidance and the regulations from the
No,
government.
it distracts them from safety, from
Right. It's not their job.
Right, exactly.
Yeah, it's not their job.
Exactly.
You know, which I guess is another thing. I think, and I do think it's posted no lifeguards on duty.
Right.
For people that are going out there.
Mhm.
Okay. All right. Is that all we want to say about the ponds? Anybody got any other thoughts on it?
I think just so that we know, people at Hart Pond, there's an area to the left where people, if they individually want to go on the pond, you know, and kayak and do all that, they could still do that. That's not closed.
Right.
It's just the beach area is closed from congregating.
As long as there's social distancing when they get out there.
Right. Mm-hmm.
It's the same thing. Social distancing in the water is as necessary as it is on the sand.
Correct.
You know what a redneck Riviera is, don't you?
Yeah. Well, we'll call you to break it up. All right. So moving on to lifeguard variance requests. Are we getting any, Sue? Are they opening their pools?
So everybody's, you know, anticipating possibly being open to the pools. We got the three applications. So Richardson House and Hitching Post condos have both submitted all of their paperwork, all of their documentation. Mark has gone through everything and has basically said that they are all set and in compliance with being granted a lifeguard variance. And then Williamsburg 1, which has 2 pools, they've submitted some of their paperwork. So basically what Mark had said is that for Richardson House and Hitchin Post, he would support granting them lifeguard variances if and when they open. And then for Williamsburg 1, to do it pending, we just are waiting for hard copies of their CPO and lifeguard certification certificates. So that's the only thing that they are missing. But they even said that they're not even sure they're going to be able to open based on what they're thinking some of the guidelines are going to be. And if they can't open potentially till July 1st, I think some of them are weighing, you know, the expense of what they would have to do to open, because they're typically only open till Labor Day.
Right.
And you know, at these condos, and then they close. So time will tell, but they did, you know, like I said, they did submit the application in the hopes that the guidance will come through and they'll be able to go. So based on what Mark said, Richardson House, Hitchin Post, yes. Williamsburg, pending, we receive hard copies of their CPO and lifeguard certification.
Okay, very good.
So you guys need to vote on that.
Yeah, we need a motion to accept the new business.
Motion to accept the new business or second, which you want.
You can make it, I'll second it. Any further discussion on any of these issues?
No.
All in favor? Aye. Okay, these are just the monthly reports on what has been done by the various members.
Anne Marie, do you want to go back to do the motion to grant the lifetime variances?
You want that pulled out of that? Okay, I'll make a motion to grant the lifetime variances to Hitching.
Lifeguard.
What am I saying tonight? The lifeguard variances to Hitching Post and Richardson House.
Mm-hmm.
Motion to accept or second?
Second. Any discussion? All in favor? Aye.
And then a motion to grant Williamsburg 1 pending their CPO and lifeguard certification.
Do you want to do that? Or you want to wait until they've complied?
My concern is that, well, either way, it's up to you.
Well, I think we should wait until they comply.
Okay.
I mean, your concern is that it's another month.
Right.
And they might be, they're going to lose another month by not filing their paper correctly.
That'd be July 7th, I believe, was our next meeting.
Yeah,
Yeah.
July 6th. What are your thoughts, Eric? You want to give them a...
They did give us a list of the people who were going to be their lifeguards and who were going to be their certified pool operators. They just did not give us the hard copy yet of their certificates. But they did give us the list of names, and we put in a request asking for those hard copies.
We're going to rely on the paperwork and Mark's judgment. And so I would be okay with making it conditional on those two things, that we have all the paperwork in order and that Mark is satisfied with that paperwork and with their preparations. I think
Is that a motion?
Yeah, because
Okay.
I also think July 6th is putting it halfway through their regular summer, and it gets kind of late.
Okay, well, I'll second that motion.
Okay.
Any further discussion? All in favor? Aye. Did you vote, Eric?
Yes, I said aye. Same time you did.
Okay.
What's happening over at Fishbones?
Fishbones has been doing a renovation of their kitchen, which they started before COVID all started. They wanted to move some things around so that they could have some more space. So they've been working very closely with Michelle on that, and I believe they're I believe they're finished at this point. And some of the inspections like that they've been doing, I mean, they were doing the COVID education and outreach to these restaurants that were doing, like the curbside pickup and all that. And then in between doing other inspections as well, but we haven't had as much sharing of the close information where we were all working. Mark and Michelle were in the office with Donna, and the others of us were working remotely for quite some time, and we just recently went back into the office. So now,
So go ahead. No, I'm fine.
I was just going to say that has anybody gone to Sully's to get ice cream lately?
No.
Every other word is Board of Health, per Board of Health. I didn't mention it. I was on the Board of Health.
Yeah.
You just kept your mouth shut while you were in line.
Oh, yeah. I'm looking down the list here, and I see also Einstein Brothers Bagels got inspected, and I'm like, oh, it's Einstein. They just said wear your mask. Both establishments did things properly, but Einstein didn't sit there and blame me for it. I blame us.
So Sue, I noticed that Darcy's been doing the contact tracing.
Yes.
And, when we reopened the law firm, we now have to keep a schedule of everybody that comes in, whether they're delivering water or whatever, and a phone number. And I fear that might be something that these condominiums are going to get saddled with also. People coming into the pools. You have to know who they are so you can trace it back.
Right. That could be part of it, along with the social. I think the social distancing is going to be the key with the masks when when you're not swimming, and if you can't be 6 feet apart. Which is why I wonder whether some of these places are even going to bother to open if their area is just not big enough to accommodate more than a couple of people. It might not be worth the cost for them. But we do the same thing at Town Hall. Anybody that comes into, and it's each individual office is part of the plan. And then the other part of the plan too, of course, is that each employee basically has to self-certify every day that they haven't had any COVID symptoms, that they haven't been in contact with someone with symptoms in the previous 24 hours, they don't have a temp, and we have to track that every single day.
Yeah, we have to do the same thing here.
Yeah.
So I do worry about that. I mean, I was at a baptism yesterday, and I think what people have to understand too is the 6 feet just isn't to the side of you, it's in the front of you.
Mhm.
And so a pew that would sit, 12 people, the most you can put into it is 2, unless they're family.
Right.
I was speaking with someone about St. Margaret's in Lowell, and that's a very large church, and they said the most they can get in there is 85 people.
Wow, that's a huge church.
Yes, that's a huge church, and that's what they were saying. They can only get 85 in there because of the 6 feet around you.
Right.
So I mean, that's the other thing they have to understand. It's just not 6 feet to the side of you. It's 6 feet all around you.
All around, right.
Well, our church up in Maine is having all their, everybody's pulling up drive-in style with the cars in the parking lot. And the Baptists learned to get along with the Congregationalists. So everybody's happy again. It's been years and years that they weren't talking until now. But the Baptists don't have a parking lot. So, well, by the way, on Michelle's thing, what's this thing about pick up car from garage? Was that meant for us?
I didn't even see that. Probably we took I think the white town car that she uses ended up having to have it when there was a recall. Well, that's funny that she put that in there.
I'm just afraid that next month we're going to have her shopping list on here.
Sue, do you have everybody coming into the office, or like is Mark working remotely generally, or?
No, everybody's in the office now. Amanda's still working from home at times, depending on what's going on for the day. I sometimes am working remotely, but we're all in the office. The office is set up in such a way that all of our desks are 6 feet plus apart. The town hall is set up so that there are markings in all the common corridors outside of everybody's office with the 6 foot distance. There are sanitizer stations when you come in either of the main doors with the sign that says, that you must wear a mask. And they've also have cleaning and sanitizing of all of the common areas, the railings, the doorknobs, the bathrooms every 2 hours. Because it is open to the public now, trying to leave as many doors open as possible so that there's not a lot of hand holding of the different doors, and basically going by all of the guidelines of DPH. And those of us that are, if I'm in my own office, I can take my mask off. Anytime I go, obviously, into the public corridors or whatever, your mask has to be on. Okay. And then we have I call it the horse door. Our door going into our office now reminds me of the old Mr. Ed, with the top that opens. And there's a little shelf on there, and they've put plexiglass up there so that when a customer comes up to the door, there's that, just like in the grocery stores. Yeah, so that's with everybody.
You're lucky you had the horse door.
Yeah.
Have the state DPH guidelines made any comments about opening windows or blowing things out? I know that as they opened up the businesses in downtown Boston, some of them actually would just stay closed, and they would open up the windows and blow fans to circulate, to blow air out. And then older buildings that kind of trap air in some places, that's been a little bit of a concern. And but I didn't know if they actually stated that it's a good idea to open windows where you can.
No, not that I know of, Eric. No, not in any of the guidelines that I've seen.
You don't want to set everybody's pollen allergies off either. But,
yeah, that's a problem.
But if you get air that doesn't circulate particularly well with odd little rooms, it's a thought.
Mm.
So you had a nail salon open up ahead of time, huh?
So I believe there was a complaint regarding, and we also had a gym that was allowing their members to just go in and utilize the gym. And when she was approached to be educated.
This is more like a private training, though. This was a personal training facility.
No, this was a different gym where they were allowing members to come in, and what she was doing is she was also what we were told, she was allowing members to take pieces of equipment home. But then there was no written protocol or no information as to what she was doing, and then she was allowing people to come in and work out. And we said, all the gyms are supposed to be closed. And she said she did not realize that. So we educated her and told her that, the gyms have been closed for over a couple of months. And, now that the state, again, is starting to put out some guidance for gyms, they're probably not going to be fully open back to what they were probably till phase 3, but they are talking now about allowing places to do outdoor fitness classes if they do the 6-foot distance and, the proper sanitizing, people can't share equipment, that type of thing. So again, that's going to be a matter of people putting those protocols into place if that's what they're going to do. But then it's also they're going to have to get involved with, depending if they own the property or rent it, in discussions with their landlords, particularly if they're going to use parking lot areas or whatever as far as liability things. So they'll have to look into that.
Okay.
But I think salons are supposed to be slotted, at least the rumor is phase 2. So as far as nail salons. So let's see.
Okay.
I actually think where Mark wrote on his drop-off own car for recall, that should say town car.
And then the American Legion had people there?
Yeah, that was in the very beginning when things were first being.
Right in the beginning. Yeah, that was an early day.
Yeah, that was when we had to really educate people as to what was happening and why. But they've been fine ever since we, told them what the.
Yeah, that was pretty early, the 17th. That was right in the beginning. All right. Any other comments, Eric?
No, if anybody hasn't voted, the election's tomorrow.
Right.
So, motion to adjourn.
Seconded. All in favor?
Aye.
All right. Thank you. July 6th, Eric, you'll be around?
I will be around.
Okay. I expect to be also, so we'll see where we are in that.
And actually, by then, Rich hopefully be voted in tomorrow, and we'll have him on the board as well.
Good. He'll bring a lot of wealth. He'll bring a lot of information with him.
Yes.
So.
Yes, he will. So, well, thank you, everyone.
Thank you. Good night.
Good night.
Thank you. Great night. Good to see everybody.
Good night.